a big old party at your house.
In October, it's our 40th reunion from RT school. And it's actually occurring on the weekend that we have Family Day and Alumni Day. So I don't know how many will come in, but I have sent it out. We'll see.
Does that include faculty?
Were you teaching us back in 1984 and 85?
Yep.
Yeah, you want to come on up?
Send me an invitation.
Let me write down on my list of.
All right, Alan, I just sent it to you.
Okay.
Yeah, under Ray Edge and Danny Edwards and Betty Johnson and I.
Yep. And Wayne Lawson.
All right, Jacinta.
Thank you, sir. Raymond, you're good to go.
Right. I'd like to call this meeting to order. Please note any comments by the public are welcome and can be emailed to publiccomment@lsbme.la.gov. Jacinda, please confirm you verify the identity of all tele and video conference participants. Is the sound clear and audible to the public and those on the tele and video conference?
Yes, sir.
All additions to the executive or public agenda must be made presently, as we will no longer make additions to the agenda after the close of the public session. Is there anything that needs to be added to the agenda?
Raymond, I would like to discuss compact licensure as far as it's concerned with our rule changes. But with Dr. Van not here, I'm not sure if it'll get us anywhere if we discuss it today or not.
Ms. Wilton, are you familiar with any of the compact licensure information? Or Lauren?
Apologies, no. Dr. Van has been attending those meetings by himself. I apologize for that, but we will make sure that he's ready to discuss that at the next one for you.
Thank you.
Thank you. All right, how is Jacinda, is the sound clear and audible to the public?
Yes, it is.
Okay. Diana, would you do roll call, please?
Yes, Sheila Guidry,
Here.
Blake Nolan. I saw
Right
him
here.
earlier. There. Mike Nolan,
Here.
Raymond Peasany,
Here.
Brett Stafford.
Here.
Dr. Hugo.
Here.
I'm here, and then Jim Lanahall. So we're missing one. We have quorum.
All righty, we do have a quorum, so we'll move on to the agenda. At this time, we have minutes from March 18th, and you should have received an email this morning from April the 15th.
Make a motion to accept the minutes.
Raymond, those minutes from the 18th of March have already was accepted and voted on at the meeting in April.
Okay.
So
Hold on 1 second, please. I have to step away. Just 1 sec. I apologize for that, having to step away. So Sheila, which ones did you say?
The March 8th minutes where it was
18?
approved. The March, well, she's got on the agenda, it says March 8th.
And it's March 18th, Sheila,
Okay.
on your,
Okay, so we need a motion to accept the April 15th minutes.
Correct.
I'll make the motion.
Michael, and then I think Dr. Hugo had made the second. All in favor? Aye. Okay. At this time, I'd like somebody to offer a motion for us to enter into executive session.
I make the motion.
Do I have a,
Second.
do I have a second? All in favor?
Aye.
Aye. All right, Jacinda, can you move us into executive session?
Yes, sir. Give me 1 second. All right, Miss Sheila, you might see a button that says to join. If you click on it, it'll let you in. Alan, we're gonna leave you out.
Okay, it looks like everybody's in. Are we streaming, Jacinta?
Yes, everyone's back. You're good to go.
All righty. Diana, would you read the motion
Okay,
and the case number?
yes, make a motion for case number 307588. The ability to obtain a non-restricted license permitting she's got everything else turned in to practice in the state of Louisiana.
All right. All in favor?
Aye.
Aye.
Aye. All
All
right.
right, who seconded? I was writing.
That was, we just seconded, Dr.
There you
Hugo.
go. Thank you.
Thank y'all. All right, can y'all bring up the rules and regs where we stopped off the last time, please?
Yep, I'll pull it up right now. Can y'all see it?
Mhm.
Can you
Okay.
make it a little bit bigger, please? Okay.
Think we finished here, but y'all correct me. Did we get to supervision of students?
We didn't do students.
All of this is the education requirements. And we discussed I think we discussed the denial of turning it in and then the documentation going to CE broker.
Is the board gonna stay with CE broker?
Yeah, I don't think we'll use it by name, but it's
Okay.
whatever auditing CE program that we have. There are
I'm
other boards have, I mean, other versions of y'all have language in their rules that outline the requirements for how licensees are to, you know, submit.
I have a question, and
Yeah.
I apologize. Are we getting this document with the changes that have been striked out before the meeting
Yes, it was in your
packet?
in your packet, I think. Yep.
In the cloud.
So this is the working document that is in y'all's packet in the cloud. It does include the changes that were made in previous revisions, I think in 2018 or 2019, that never actually made it into law. So that's why it's a little tricky to see where we stopped, like what was the previous changes and what
Right.
was this one. Um,
Maybe we
I
need
know we
to
said it last time, we
reflect
should put
that
like a
in
big,
minutes.
yeah, put a big thing on it. And I'll do that for today. So y'all just remind me.
Okay,
Y'all
so
want to start with students?
hang on just a second. I wasn't here for the last. I just have one quick question to ask. So for CE broker, we go on, we upload our CEU certificates or the AARC, anyhow, what AARC accumulates on us, we upload something. And then it looks at this and says, okay, you passed. And we also sign off on a statement that says we know we have to have the 10 CEUs. Is there any external person auditing any of this? Or it is strictly electronic and at its worth?
Is there any sampling?
It's my understanding, Patricia might know the ins and outs of this better, but like we give CE broker a list of approved courses and then the applicant would go in and upload yada 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 of what they took, and that it gets checked and there's a transcript. And so when they go for licensure, they review that transcript.
Right. There are courses or course providers, I think is probably more accurate,
Right.
uh, who are already approved and with CE Broker and us. And so it's just automatically credited. If somebody wanted to do something more than what's already approved, it has to go through the board process of approving that as an approved course or provider, and then we let CE Broker know to add that to our approved list.
But I think your question, Diana, is there's some kind of, I think like number C that's listed on there, a random audit to assure that they're submitting an appropriate,
Yes, Phyllis, you'll have to tell me if we do that for allied health. I know we do it for physicians. They have an audit schedule where they audit the CEs for physicians. Do they do that too for allied health, Phyllis? I don't know.
Audit the CEs,
Yeah.
CE broker, uh, since they
We
have to,
used to,
I mean,
this
like
committee used to do that.
going
Yeah.
through, go,
And it was not unusual for us to find individuals that did not meet. And again, I know we've got specific. I guess one of the reasons I was asking is, when I have to renew my PT license, I have to find the courses that have been approved, and then I have to upload all of my certificates to the website, and then I get told, please watch your email. You very well could be audited. If so, please make another copy and mail this stuff into the board. And I'm asking because we haven't done this.
you froze, Diana.
She's frozen.
uh, with CE broker, I mean, your CEUs are examined every time you upload it, is my understanding. I mean, that's why there's no need for the audit, is my understanding. Because when you got to have your correct CEUs to even renew your license.
I know when I do mine, I upload my transcript as it comes from the AARC, and it doesn't show ready until I've uploaded that.
Okay.
I guess the question is, if we do the physicians, why don't we do anybody else?
Well, that may have just been a COVID thing. I'm not 100% sure, but I know that from time to time, Dr. Francis in investigations and Dr. Cresswell before him had audit letters go out for physicians who had not completed their CEUs, and that may have just been a COVID thing. It may have just been a pre CE broker thing. I might be telling you all the wrong information whatsoever, but I know right now everything, as Phyllis said, everything is automatic, really, and so you can't renew, or if you haven't completed it, and the only wrinkle would come if you weren't trying to get something approved through CE broker that isn't already approved. So unfortunately, once again, Dr. Collada is our CE broker expert, and he couldn't be here today, but
Question. Raymond, I wonder in the agreement that the State Board of Medical Examiners has with CE Broker, if there's a section or a clause requiring them to do random sampling to see if they're getting the right information.
I'd imagine this is a holdover from when it was originally promulgated in 99 or even in 2012, where the applicants were just sending in their list of CEs to the board for review. So now it's when you send in a CE, it's timely approved by CE broker and added to your transcript. And then that connects to our licensing division to where like Patricia said, you're not even allowed to renew if you haven't met that criteria. So like the use of the audit would maybe be a little superfluous now because the only way that people are getting credit is if we've already pre-approved that course. And there's no way that we could go back and be like, were you really watching the online course, you know? But that might be something we can look into taking out. Or if it is something y'all want to do, we can leave it in. Or maybe we look more into it and come back next meeting to talk to Susie and Dr. Van about what exactly they
I
do
guess the
that is still
question
purposeful.
to Diana's point, somebody could say that this was an ARC proof course that they selected, but they submitted a CEU for a non-approved, one of our non-approved sponsors. So where's the checks and balance?
The checks, it's my understanding that in CE Broker, they have a list, like courses have like a course number or a course name, and that's approved.
Right. An unrecognized or previously unapproved course wouldn't upload. It wouldn't take it.
Okay, so again, I've just known some what's prohibiting me from running down the hall and getting Tim Gilmore's certificate and running it through the copy machine, writing out his name, and then putting my name in the middle of it and uploading it?
There's
The law.
There's also, yeah, the law. There's also nothing to say that you sign into a CEU and then you immediately leave and you still get credit for it. I mean, it's kind of an honesty basis.
Well, some of those are getting a little bit better in that they're putting the QR codes up, and they put them up after the meeting, so you can't QR it. And then I've also been scanned when I was leaving the meeting. That doesn't mean I didn't walk in 5 minutes before it ended either. So I get that. It's just I was just asking the question of, and I'm not saying CE Broker is not doing their due diligence, but that was one of the things that you know that I question. I mean, I don't work on the CE Broker, and I don't know how that works. I don't know if it looks for a AARC buzzword, if it looks for an AARC number or what. I was curious.
Yeah, absolutely. I highlighted it. And maybe for the next meeting, we can have Susie Allen, who's our education director, come on to explain the ins and outs of it a little bit better because she works with them every day. And then also
Diane,
Dr. Van will be back.
Okay.
Diane, under section 2563, someone highlighted section
No.
C. Does that meet with what you're asking? What's
Well,
this?
that's our current rule, but since we went with CE Broker, and maybe even slightly before then, we stopped doing any audits.
Yeah, we did. Yeah.
Yeah, we did.
The committee
But
did.
but as it was just pointed out with CE Broker, they may still audit some of the physicians. I was just asking the question of, and I know we'll never be foolproof, and if somebody wants to break the rules, which I'm not, they'll do that. But so it's a question for, for Dr. Van. I hate to see that we don't do an audit occasionally because I think people get complacent.
And we need the verbiage when they renew their license that there would be random audit.
Okay. I think it would be best if we bring Susie, Dr. Allen in, and we can further discuss with Dr. Collada at the next meeting. Is that in agreement with everyone?
Yes.
Yes.
Perfect. And then if we're good with that section, we can move on to students. supervision of students. Can y'all see everything?
Yes.
Yes.
Can you scroll up so see under supervision?
I have a question for the attorneys. Is there any other discipline under the LSBME that allows students to do any functions while they're in clinics? Not while they're per se in clinics during their education, but let's say on the weekends when they're off, can they do certain functions of that profession after they're
No,
in clinicals or whatever?
no, that would be
Okay.
practicing without a license.
Okay.
Do y'all use them often? Is this an
No,
older thing? Because
it
this
was
was
during COVID they did, but that was an exception to help out in the workforce. But I was just, it was brought up to me at the state meeting if we were looking at anything to allow students to do limited functions while they were in school, even though, when they're, I say in school, during their curriculum, but not per se part of their curriculum, like on weekends, after hours, and things like that. But
Yeah,
again,
it
it's
seems like this was a hot button topic because it was originally promulgated in 86 and then again in 93 and then in 99 and then not until 12. So maybe this was something, 20 something odd years ago. They did a lot more than currently. Maybe that just has to do with the population of RTs in the state. This little description in question in blue is from the 2018 or the 2019 edits.
I don't have a problem with it. Can't think of a negative reason why they could not.
My only question, and I don't have the answer here because I haven't undergone a co-arc site visit. Is it co-arc that limits the educators to 4 students?
the 4 students for what, Diane?
Okay, so
Yeah.
I'm under B, supervision of students. Go down top of page 17B and number 1. Undertake to keep going, right there. B1, undertake to concurrently supervise not more than 4 students. I only question the number 4. I think 4 students is enough, but again, the last thing I want to do is have something in our law that does not coordinate with what COARC says these programs can do. So I can research that.
Okay. Sheila? You're on mute.
Yeah, okay. Down 2575, A. Just a simple question when it says, advanced practice registered nurse. I'm assuming we're talking about nurse practitioners there.
Yes.
Okay.
Well, aren't CRNAs considered advanced practice nurses as well now?
No, I
They're
thought
separate.
CRNA, I thought CRNA was listed as like it is
Yeah,
certified RN anesthetist.
Yeah.
yeah, I think they're a separate category. I think Miss Sheila may have her hand up.
Sheila?
You, no. My question was just about the advanced practice nurse, registered
All right.
nurse.
Your hand is still up.
I'm sorry.
You're
Her hand
saying that
went up the whole time.
Sorry.
you're saying that there is a, besides a CRNA, there's a CNA.
No, there's a advanced AP
RN.
RN.
Yeah, I
And
understand that. I'm talking about nurse anesthetist. Is there? It's listed as certified nurse anesthetist. It should read certified registered nurse.
Good catch, Mike. It
Yeah,
should.
we'll add that. Those were the previous edits, so good catch on this one. And is there anything to say about, so can any of these people, a physician, a CRNA, APRN, or PA, supervise a student just cause?
Well, they could be going through intubation rotations through surgery, and they may be under the direction of the CRNA.
That's
Yeah.
true.
That's correct.
Or they
Yeah,
could
that's
be making
typically where that
rounds
comes
with a
up
nurse
from.
practitioner.
Let's see. I'm sorry, Sheila, what was that?
They could be making rounds with a nurse practitioner.
Or a PA?
Yeah, or a PA. Mhm.
Especially if they're not outpatient clinic.
Yeah, outpatient rehab.
Blake, did you have something to say? I'm sorry if I missed you.
I said also in rehab, South outpatient clinic, even long-term care, skilled nursing.
Mm-hmm.
So Diana, you're going to look at COARC standard for the supervision
Yes.
of
I just want to, again, I don't want us to say 4 and COARC says 3. I don't want us to say 4 and COARC says 5.
Yeah.
I want to be on the same page.
That's right.
I do just have one other question since y'all brought it up. Why do y'all do this and not other allied health? Like, why wouldn't an OT want to be supervised under these people? Like, is there a reason y'all supervise students?
sorry, where is that, Eddie? Which one?
No, I mean the whole supervision of students portion.
Okay, well, all right. So let me.
I'm just curious. Sorry, I just don't know much about it, so I was kind of.
No. From an education perspective, when I had the students when I was teaching, I could utilize a licensed therapist to work hand in hand with my students at bedside. I could go bedside. If I assigned them to go to pulmonary clinic, there might not be another respiratory therapist over there.
Gotcha.
So it would be a physician, a PA, or an advanced practitioner nurse that would be working in that clinic, and my student would be side by side going in with them to evaluate the patient, to go back and discuss the x-rays, to discuss a plan of care, And then when our students did a anesthesia rotation for intubation, they might be with the anesthesiologist, but if not, they're with the CRNA, putting an endotracheal tube in someone. So it really depends on the clinical setting that they're in.
Gotcha. Okay. Thank you.
Mm-hmm.
So if we're good on that, then we can just go down to this practice part, 550501 simple. And now it's in unauthorized practice. We're getting rid of the temporary licenses, so that was taken out. They're only registered, not certified, so that was taken out. If y'all have any other changes.
Wait. Licensed therapist currently certified. I think that's something that we needed to go
Yeah.
back and discuss.
Right.
Right.
Certificate the CRT and the ORT if we were going to keep.
Yeah.
Uh,
I mean, till they die or retire.
Well, again, I think that's one of those that
We put
the thought before COVID was these schools are training these students to be registered respiratory therapists. They should be able to go out, pass that board exam, and become registered respiratory therapists. And we wouldn't license, we did not want to issue a license unless they are registered. However, my first class, which was back in 1990, some of those guys are still practicing and they're only certified because when they went through the program back then, the certification did not have a degree attached to it. So there's no way these individuals could even go back to school if they wanted to without having to take a lot of classes. So I don't know that we can take certified out of there.
You can't put people out of work.
No. And the goal, Mike, was never to put anybody out of work. It was to grandfather what we have, but raise the standard on how we went forward.
Oh,
when we
yeah.
got registered.
Yes, I
Sheila?
understand.
Oh. Sheila, you're on mute.
Sorry. According to the NBRC, if and ever they drop the CRT credentials, they will be grandfathered in. That's according to NBRC, correct? According to Lori Tinkler.
I would think
That's
so,
what she told
Sheila.
me a couple of weeks ago.
That's what exactly, a couple of weeks ago at the convention. Okay, so with that said, why do we want to keep these? Why would we want to keep these initials? Why can't it just read licensed respiratory therapist, period?
Yeah, couldn't we remove certified or registered and just put credentialed?
Yeah, see, that's what I was thinking. Because then it covers it.
I think we only do LRT now, if I'm not mistaken. Phyllis?
Yeah, I'm an LRT on my license.
I don't think we do see certified or registered anymore.
Right, you mean how the
Is that-
credentials are set up in our system?
Yes.
Right,
Credential
License-
sounds good to me.
licensed respiratory therapist.
That's correct. Yeah, you're right, Miss Phyllis.
So we need to change that here.
Okay, hang on.
Who's that?
I'm getting a bunch of different things here. So basically what C is saying, I am a licensed respiratory therapist. Now, again, everything is electronic medical records. I have no idea until you go back and read your note how your system puts you in the computer. But all this is saying is if I'm in good standing with the NBRC, I can put RRT behind my name. if I'm not in good standing with the RRT, I can't put those credentials anywhere. If I've got a license to practice, I can use LRTC or LRTR. I'm reading C is just saying, in the state of Louisiana, what can I put behind my name?
It's LRT now. If I'm not
Okay.
mistaken, that was changed because Dr. Collada had called me, I don't remember, a year or so ago. They were doing away with the LRTC and LRTR to simplify things, and it was going to be a licensed respiratory therapist.
Okay, so Brett, I'm working for your facility. When I sign off on a patient note, does it just give my name or is there a credential behind it on your electronic medical records?
I'm gonna have to pull it up and look, to be honest with you. I don't know.
Mine is my credentials.
Is it then
So-
mine's the same because we're all on the same we use the same Epic network.
Okay.
So Raymond's is
Yeah,
Epic.
FMOL HS Epic is the NBRC credential, not the LRT, but the CRRT.
Okay.
I think with the, oh gosh, what's the name of it? It's reimbursement issues. It's credentialed.
Yeah.
They don't say licensed or certified for any of them. Credentialed.
And a little bit of history on that. The LSBME cannot issue a registered respiratory therapist license or certified respiratory therapist license, those credentials, because they're federally trademarked by the NBRC. We tried that years ago, and the NBRC said that we had to, when we were rewriting the rules, take that out because they own those credentials.
Do we need this section then? In the unauthorized.
Then you could get rid of C.
Yeah, if it's that much of it, I mean, all it's saying is that if you're registered in good standing with the NBRC, we tell you you could do those two things. But if those things aren't even
Again,
around anymore,
that's-
do we need it? It kind of seems out of place in 5505.
I think Blake really hit it on C. It's a licensed respiratory therapist who's credentialed by and in good standing for the NBRC.
But I guess the question here is that de facto, that section C as it stands now, is this de facto meaning that you cannot represent yourself as an LRT unless your credentials are valid with the NBRC?
And why would that be here and not in our
That's what I'm asking.
qualification section?
Yeah.
It just seems
That's what I'm getting at. It kind of creates a question as to which one applies, you know?
It does. And I was going to say again, I've slept many a night since we worked on this back in 2018 when the NBRC slightly before then started having us renew our credentials. Ancient dinosaurs like me were grandfathered in. My credentials will never expire. However, the class that I graduated 5 years ago, their RRT credentials expire. And I guarantee you there are individuals running around out there that do not have or are not in good standing with the NBRC. Because our licensure law says you have to be in good standing when you get your initial license. It doesn't say we have to be in good standing every year when we renew. And we've had this discussion before.
Yeah.
There has to be a way to simplify it.
Yeah,
I may
because
have
right
to-
now the onus is on people like me to make sure, like, because that's part of our hiring process is you will maintain your credential, not just your licensure. And so it does become tricky. I've had to let people go over it. You know, look, you either maintain through the CMP, you retest, you submit your CEs, whatever you got to do, but I got to have an updated credential or you can't work.
This is also addressed under B, using the name, the letters LRT.
it seems that if you want to have being in good standing with the NBRC as a qualification for renewal of licensure, then that should be put in there and it shouldn't be in this
Yeah.
random section.
Mhm.
So
Yeah,
if
it
you
should all
wanted
be in
to
the same.
turn on, hey, you're not in good standing, therefore your license is invalid and you need to alert the board, that's a whole different thing than having it in this C.
I know Jim Lanahaw had brought up the fact that we have a number, not a lot, of certified respiratory technicians, and we do not want to exclude them in our state law as a licensed respiratory therapist. So we got to figure out, I guess this is what C's trying to do.
Yeah, but even the CRTTs, they have a credential, right? I
Yeah.
mean, they're credentialed.
Yeah.
And I think it goes back to what Diana was saying earlier, when we initially looked at these rules pre-COVID, the push by the AARC, COARC, NBRC and all was, to move towards ORT credential as the minimum level of education. We know since COVID, things have changed, and that's something that we'll have to decide if we, because it's further up in the rules that we said we discussed at the state convention, which I did with the management section and other groups. If we wanted to maintain that entry level, be the registry level. And the feedback that I got that, they don't think it would be wise for the workforce. We could, somehow cripple it. And even though we grandfather some of those in, so I don't think we're going to move towards eliminating the CRT credential, because the NBRC is not, when they update the test in 2027, the CRT is still going to be one of the credentials that you can earn.
So can we simplify by like A, just saying no person shall engage in the practice of respiratory care in the state of Louisiana unless he has in his possession a current license or let me go back down where are in good standing with the NBRC. Let's see, are in good standing, or credentials that are in good standing with the NBRC, something like that.
But you said or. You don't want
And,
or.
no, I'm sorry, and, yeah, it should be and, both.
Reading this again, it seems like, so in B, that's where they're saying like, hey, you can't put it, unless you are, licensed and whatnot, you can't have LRT. But if you're licensed, because you already have to be licensed, so it says a licensed respiratory therapist, and you're in good standing and certified to register by the NBRC, then you could have not just LRT, you could have LRTC or LRTR. So it's more of like it seems more now, I guess, clarifying that, or no?
No. We're trying to get rid of C, I think, right now. The only other time that it would be if they're in the VA system. But they still have to get they still have to be credentialed from NBRC, don't they now?
I think the VA did move to that. I don't know if we have any true LRT C's working. I used to work with a girl that was on the job trained, so she didn't have any background education. She passed the exam that was given by the board. This was back in the late 80s. The girl is still alive. I don't know if she is still practicing, but she held a license from the LSBME based off of that board exam. And at one time, she was practicing on Barksdale Air Force Base. So that's federal government there, and they kind of do their own thing. And I'm trying to remember if that's why we looked at this LRTC, and again, those credentials at one time were used by the LSBME to differentiate between the two classes and therefore differentiate the pay for a new license. And we got rid of all of that. We're
Right.
at one level.
Right.
I guess, what are we trying to achieve, guys, with this
I'm not-
section?
Simplify this, I guess.
Well, the LRTC and the LRTR is gone. The state board only recognizes LRTs now, either
Yeah, I'll be
certified or
honest,
registered.
I've never seen LRTC or LRTR. I had no idea what that was till now.
So you're still wanting people to be able to use the credentials, if they're signing off on a chart or whatever, LRT, licensed respiratory therapist, versus their credential,
That's an organizational,
Yeah, and I was gonna tell you, I did log in and verify here. It has CRT and RRT listed under my staff or whatnot on the document signing.
And because Epic does that because there can be reimbursement differences between the different credentials. I'm not aware of any that are still in effect, but at one time,
probably.
and I know there are still some of those between like your LPN and RN. So they want that credential distinction in Epic. They don't really care about the licensure.
Well, when you're given a license here in Louisiana, mine says RRT.L in my number. What does someone who's certified get?
So now, like mine says LRT 215. I was the 215th person to take it after the change. So since what was that, Diana? 2007, the year before I graduated.
I guess.
They get an LRT dot, a 4-digit. Previous to that, I believe it was CRT RRT, wasn't it, Diana?
I'm number 36. Mine says RRTL. I'm with Mike Nolan.
So y'all,
Mine's an old RRTLO number.
so Blake says something different than y'all's, Diana.
Yeah.
I'm the baby.
I'm confused.
So
No.
they're
They used to differentiate RRT, so they didn't go back and assign, because me and Mike, we'd come unglued. We like our low numbers. They didn't go back and reassign us a license number under LRT.
Okay.
It's just that when they changed it, everybody forward went with LRT and a license number, but mine is RRT.
Got it.
So I think it's anybody after June of 07 has an
Yeah,
LRT as opposed to a CRT and an RRT.
That's correct.
So LRT could represent someone who's certified.
Yeah.
By the BRC.
Yes.
Okay. Not okay. And RRT, no, that's not correct. It's a registered respiratory therapist. I guess that's how it's done.
At the end of the day, C isn't saying that someone can't do something. It just says that if you are an LRT who is certified or registered and in good standing, you may identify your credentials as LRTC or LRTR. So if you want to allow people to still do that, we can keep it. If you want to take it out and just have people and just not say anything, not say that you can't, just say that, just not say anything on it, we can take it out, or we can leave it in and people can have that at the end of their names if they so wish. Or we can highlight it, think about it, and come back to it.
Okay, and I'm gonna make one more statement, then I'll shut up. Maybe we changed what we did in C, thinking that there may be some people out there that are holding a license and not a, well, if they didn't hold a current credential, we wouldn't let them put C or.
I was going to say that C and R stands for something that they'd have to have.
Right. If they're not holding a current credential, they couldn't get a license.
And C anticipates, at the beginning that they're already licensed. It's just allowing LRTs who are already licensed to say whether they're certified or registered. Which
I mean, do we
I don't know if
necessarily
that
get
matters to
involved
you.
in?
It does to those who are certified. Yeah. We've had this discussion with that group at the conferences in the past.
Then if they care to keep it, then and it's not
Yeah.
changing anything, then let's just let them keep
It's
it.
a small group, but out of respect and recognition for their, I mean, they're excellent. I mean, they're very good. But
And this isn't saying that they have to. It's not saying that other people have to do this or anything. It's just saying that if you're registered and you're in good standing, then you can say you don't have to put just LRT. You can put LRTC or LRTR.
But then you have to leave the certified in there, certified or registered. If you're going to
Right.
use yeah.
I
And
think
that was taken out in the 2018 or 2019 version.
yeah,
So
and it goes back to what Blake said. That word registered by, the word registered gets a little confusing. Certified, credentialed is currently credentialed by and in good standing. Then it leads to either the certified or registered. I'd go for this credentialed and get rid of registered. You know where you have confined, certified struck out, strike out registered as well and replace with credential. That's what I think Blake has recommended.
Yeah, and the reason I would say that is it also future proofs us, right? If at some point we do phase out certification as a credential,
Yeah,
we're fine. We don't
yeah,
have to go back and modify
Yeah.
anything.
right. What do you think, Di?
I like it. And again, I would, and this is just me, I would never use LRT-R unless my hospital facility used it. And so I'm still trying to figure out why this was in here to start with, but I mean, we can do it by that.
Is that a home health thing, Diana?
No. This was done because of that certified group.
at one time, that's how the LSBME recognized the different classifications, if I'm not mistaken. It was either
Yeah.
LRTC or LRTR. You were certified or if you were registered. And then they went to do, then at the board, like I said, I've had conversation with Dr. Collada. I think they wanted to simplify it and, just go with LRT.
That's what I thought I remembered. I mean, the LRTC goes, like Diana had said, all the way back to the beginning when the board themselves gave exams out. I mean,
Let's come back and maybe we get some discussion from those therapists that are certified rather than registered. I can think, 3 people right off the bat who I've discussed licensure with that have want to be recognized as certified, not registered therapists. Don't ask me why, but it's territorial.
this does not certify them as registered, licensed respiratory therapists. It doesn't say licensed registered therapist, it says licensed respiratory therapist. That's either certified or registered.
Correct.
So
it just allows them an ability to put whether they're certified
Right.
or registered.
Yeah.
It just gives them
Yeah.
the ability to
Yeah.
further clarify their LRT license. So if it's not that big a deal and people still okay with it, then we'll just leave it. And if it's, not necessary anymore, we can take it out. But probably good to move on. We can go to the exemptions. Yep.
I do have a question when we get finished with this, just for the group. I'd like to ask a question at the end.
Are y'all good with 5507?
Number 4 always creates heartburn for us for some reason in the past.
Yeah.
And doctor, where's our physician? I'm sure he had to get off.
Yes,
Well, I'm
He's the one
assuming
I want to ask him how he feels about
Yeah.
this.
You remember the history on this, Raymond?
I do.
Why don't you explain it to the group here?
Oh, that goes all the way back to the beginning of licensure. I'll have that one off with you. But that goes all the way back to the initiation of licensure in 1985, if I'm not mistaken, Sheila.
That's correct.
19
We had
look,
we had some opposition to people that worked in pulmonary labs. Okay.
yeah. Can we just highlight that and we'll have a discussion with Dr. Hugo about that and get his views?
so. Would this be like an accommodation for RPFT, CPFTs?
Well, one time, Blake, we asked if we could do something in there that if somebody's going to work in a pulmonary laboratory and they don't have another licensed professional, so an LPN, the physician trained, I'm still thinking, please go take that board exam so I know you knew what you're doing. But the reality is, if you were a pulmonary doctor running your pulmonary clinic and you wanted to hire your next door neighbor at the age of 18 to come in and do your PFTs for you, you can.
And it's time we stop it.
Yeah, especially, I mean, it's not like the old days. I mean, there's complete PFT suites
Yeah.
with all the ins and outs and complexities of, excuse me, of that testing being performed. We need to make sure they at least have that RPFT or CPFT credential.
I think so.
But I guess that begs the question, are we getting into the RPFT, CPFT licensure game? Because that is independent of your registry or certified therapist status.
Yes. So I think that's a touchy one.
Yeah, I'm assuming that will require legislation.
So does anybody on this committee right now know someone who's working in a pulmonary lab that's not holds a credential as a respiratory therapist?
I know some that are RPFT. They are not therapists, but they, independently took that RPFT exam. So they are credentialed, they're just not licensed as therapists.
Right. Yeah, that's going to be a tough one.
And I'm pretty sure I know what the MBRC will say is it's a credential like any other credential we issue. Now, whether or not we want a license for it is up to us.
Well, it's up to us to decide whether we feel that they should be respiratory therapists. I mean, CPRT or RPRT, that's fine, but do we want them to be a respiratory therapist? That's the question here.
And
I
I think,
don't-
Because this
Go ahead,
allows
John.
them to practice without a respiratory license.
Yeah, I can say the way this is worded, I take this to mean they could, in theory, in the context of this physician office, do a methacholine challenge, which I actually think that's covered under the RPFT. But they could administer breathing treatments, do education on meds, things like that under this provision, which certainly is not something a CPFT or RPFT should be doing.
Blood gases.
Yeah, that's right. Blood gas, any type of draw.
Mm-hmm.
Now, I will tell you, as far as our labs, they're all respiratory therapists, but we did take my son years ago to a ENT or whatnot. We're doing some uh, allergy and everything done, and they did a bedside screen on him, and it was done by the nurse or whatnot. So that, and it was a physician's office. So that's that provision right there that catches them. That's the way I've seen it used before.
Well, might it not be wise then to just restrict it to pulmonary function testing, or even specifically spirometry? Yeah, because I'm kind of with you. I don't necessarily think that it's a great idea for diffusion studies or any of the other pulmonary function studies that can be done need to be performed by somebody who's not, at the very least, an RPFT or CPFT. So I think, yeah, it might be good to just kind of limit what that role is, because you certainly don't want people, performing ACLS intubations in the doctor's office.
Well, so let me compare this to another section, home health. Okay, we don't allow, we allow home health agencies to deliver equipment to patients' homes, but a respiratory therapist has to go and do the instruction, to the patient, to the family, blah, 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 blah. So if we're allowing that, if we're expecting a respiratory therapist to do that, but we're not going to expect a respiratory therapist to be in a pulmonary lab doing everything that entails pulmonary functions. I guess the bottom line, I'm saying I think they need to be respiratory therapists, but.
Okay, we have about 4 minutes left because I know our Zoom cut off last time from the LSBME.
Yeah.
So let's ponder this a little bit. We can stop at this one and review it and come back with some discussion at our next meeting. And for the sake of time, Mike, you have about 3 minutes if you want to, you said you wanted to ask something?
Yeah. I hope this is appropriate. Have any of you
we're on
that
public.
say again?
We're being streamed live right now with the public, so I don't know what you.
Okay. No comment. Forget it.
All righty, but does anybody else have anything they'd like to add before we adjourn for the day?
And so noted, we're stopping at section 5507 on exemption.
Yeah, number 4. All righty, do I have a motion to adjourn?
I'm going to adjourn.
Do I have a second?
I second.
All in favor?
Bye.
Aye.
Aye.
Thank you, everyone from the State Board, for your assistance today.
Thanks, guys.
Okay.
Right.
Have a good one.
Have a great week. Bye-bye.